Good day everyone, thank you for joining me for another session of how to use health check range of test cassettes. Today we'll be talking about how to use health check BG check blood glucose monitor. Blood glucose monitor, it's a device used to detect blood glucose level in the blood. It's only recommended for people who want to screen for whether they could be elevated blood glucose level in their blood. If you get a blood glucose monitor, health check BG check blood glucose monitor from your pharmacist, they can easily help you to set it up. If not, then through this video you can easily find assistance with setting up your blood glucose monitor as we go in this session today. When you buy your device, in your device is available a box pack. In this box pack, you find the BG check glucometer device itself. Alongside with it is a pack of 10 strips in this bottle, and then a pack of 10 lancets in the lancet case holding. Also included is the lancet holder, which you use for piercing your finger. It's a device used for piercing your finger with the lancets. On setting up your blood glucose monitor, all you need to do is turn the device to the back, open up the battery compartment part, and remove the battery protector. Just draw it out. On removing your battery protector, your device gets in contact with the battery and then it comes up. It comes up indicating your month and your date. It also indicates your time. This is the start of the setting up of your blood glucose monitor. You see your cursor indicating on the first number on your health check BG check meter. You set up your device with the M and you set up that setting with the S. To start with, you pick the M to the month, whatever month you are, like you're in the 11th month of the year. You select by pressing this button to number 11, which indicates the month. You set up whatever you have picked with the S button, and then it takes you to the next cursor on this blinking lines. It takes us to the date. Then you press down your M to pick your exact date. I have set up the date, and then you press your S to send in that message into the monitor. When you do that, it moves you to the next cursor, and the next cursor indicates your time of the day. Your time is set in 24 hours, so you use the M to pick what the hour of your date. So now I'm picking 14 hour, that is 2 p.m. Then you press it with an S. The S takes you to the minute and then you pick how many minutes you have on your time. You use the M to press that, and when you are done with picking your minutes, you press S to set it. On setting it, it takes you to the 24H, which is telling you whether you have 24 hours timing or a 12-hour timing. You can change this setting by pressing your M. Pressing my M will take me to the 12-hour timing to give you an AM or PM time zones, or the 24 hours timing, which gives you the 12 hours and 13 hours thereafter. But today I will set it up to the 12-hour setting to give me the AM and PM time schedule. I will set it up with that. The device default setting is 2 mg per diem. Well, you can change your settings, your device setting, to millimole per liter or as preferred. In most cases, many people prefer it at milligram per diem. If you need to change your setting from milligram per diem, which is the default setting, to the millimole per liter, then you press your two buttons, the M and the S together, for a couple of seconds. When you press it down like I'm doing now, together, it changes to millimole per liter. If you need to change it back again, you press it down together and it takes you back to milligram per dl. I've seen on my device. When you do that, you press your S button to set it, and it sets to your preferred unit region. When you do that, it comes up with an alarm time if you want it to set up an alarm for you. In this case, I'll say no. Shall leave it at 0 at 0. Then I set it, and then your device is ready for use. Using a L-check blood glucose monitor device. Using L-check blood glucose monitor, you need to make sure that your code at the left side of the device is the same as the code on your sample bottles that come with the pack. In this instance, we have 284, and so 284 is also available on my sample test strips bottle. As the device is set and ready for use, all we need to do is make sure that we have an alcohol pad to clean our fingers. Clean your finger that you intend to lacerate. Make sure it's totally clean and disinfected. Then you set up your lancet holder by opening up your device. When you open up your device, take a lancet and turn your lancet into your lancet holder while you press down. Then you hear a snap. After you have done that, twist the cap of your lancet to reveal your pin. Then you cover the lancet back. When you do this, make sure you place your lancet into position by pressing down the bottom of the lancet holder. Also, the degree of laceration on your finger will be determined by this arrow and the numbers placed below. Above the line is the numbers, and this indicates the rate at which you want to lacerate your finger. You can set the arrow to either 5, 4, 3 by turning the first tune of this lancet holder. Turning it around will show the arrow around this button, indicating how far you want your laceration to go. If you're an adult or you have very thick skin, you can go for a 5. If your skin is pretty soft, you can go for a 4. In this case, I'll be going for a 4. When you do that, then your lancet holder is ready to use for lacerating your finger. It is less painful when you use your lancet holder, and it is done this way. By pressing this blue button, it helps you to lacerate your finger. My finger is on the little blue button. I've already cleaned my finger and I will press. My finger is already lacerated. When you lacerate your finger, you find your blood coming out. In that instance, you open your test strip bottle and you take out one strip at a time. L-check blood glucose monitor strips are capillary tube test strips. In this instance, you put the cartridge edge into your device at this point. The cartridge edge into your device at this point. Then the cartridge edge goes into your device. Immediately your device sees the cartridge edge, it comes up on its own. Immediately it starts indicating that you should put your blood into the test strips. This should be done within seconds. Or because the capillary tube, you touch your blood with the tip of the strip, just like this. The strip sucks in the blood on its own. It is really very to use. And then your result is out immediately. To release your strips and avoid contact in instances where you are helping other people, press the back button down and it releases your strips. That shows that you have actually completed your test for blood glucose level. Thank you so much for joining me once again. I hope to see you in another episode.